Welcome to Placebo, a new podcast where my sister and I teach each other about interesting things in healthcare and medicine. I'm Logan Richards, and this is my sister.
And I'm Kaylin Richards, and today's show will be about our show's namesake, the placebo effect. But first, we need to mention that Logan and I are not doctors. We both have graduate degrees in healthcare-related fields.
Well, I'm still working on mine. But Kaylin works in a hospital as an occupational therapist, and I'm finishing up my degree in physical therapy.
That is correct. Our podcast isn't necessarily going to teach you how to be healthier, and we aren't going to provide any medical advice.
But we are going to explore and talk about cool topics in healthcare by taking research articles and kind of translating them from their researcher language to something a little bit more accessible that fits nicely into a podcast. So future episodes, we might look at things like conversion disorder, how your hospital's designed, how you sleep, pain, and anything else that we want to talk about. Okay, so the first thing that I want to say is that there has been a lot of writing on the placebo effect in the media. There's been podcasts about it. There's been two big podcasts about it.
Two big ones.
Well, How Stuff Works in Radiolab, which if you listen to podcasts, you know what those
Probably
are.
have heard of those ones.
But so you might hear me mention some of those things today because we listened to all of that in preparation. Mm. But we kind of wanted to look into the data for ourselves and see what we could find. So can you tell me what the placebo effect is?
All right. So generally, in my general knowledge, I think the placebo effect is when you take a medication, or you think it's a medication, you take a sugar pill, and it actually does help you.
Yeah. Okay.
Did I do it?
I think that's getting there. So, this is kind of what I feel like you might hear on the street.
That's what I say when I'm on the street.
Yeah, on the street, people are just saying the definition of placebo. So you might hear like a sugar pill or a fake treatment or fake surgery, or kind of more sciencey sounding like an inert substance, meaning a substance that doesn't do anything. Or even like trickery and deception. Mm-hmm. But kind of the first point that I want to make is that there's really, in the science and, in general, there's no agreed upon definition of placebo.
What about the dictionary?
There is a dictionary definition. Well,
They've agreed on one for the dictionary?
That's not even true, though. All the ones I found are different. But I have that. It's coming up.
Okay.
So the first thing I want to say is that there's this researcher from Iceland. And so I won't say his name correctly, but it's Hjorgetsson or something like that.
Is his last name?
Yeah, it's his last name.
Okay.
And it's not spelled the way it sounds,
okay,
so maybe it's different. But he says, the entire idea of placebo is very soapy. It slips away whenever you try to find a border. So here's what happened when I asked the internet.
Okay. What is the placebo effect?
Yeah.
Okay.
So a common thing for the internet to say about placebo is that it's a substance or a procedure that is inert. Uh-huh. And of course, me not very good at words, I looked that up.
Inert?
And yeah, you probably know what it means. Tell me what it means.
Doesn't react with, like an inert chemical would be something that doesn't react with other chemicals.
But there's also things like motionless and listless, and so basically it doesn't move, it doesn't do anything.
Like a slug is an inert insect.
Maybe sort of.
It's not emotionless, I guess.
Okay, but you also find things like a substance that has no therapeutic effect, used as a control in testing new drugs. So you often hear about that in the media too. Like they'll say, we tested this new drug against a placebo, and what they mean by that is, they're not, the people that are getting this placebo is a sugar pill. So that's kind of where that definition comes from. Mm-hmm. And then another one that I found is a placebo is anything that seems to be a real, in quotation marks, medical treatment, but isn't.
And it's fake.
Right. So we'll get into that. Anyways, the kind of lowest level of internet search would suggest that placebo is this kind of not very sciencey thing that is fake, maybe not a medical treatment.
That's what I said, right?
Yeah, that is what you said. But it's probably not what it actually is.
Okay.
Okay, so I'm going to try, since we think segments are a good idea, I'm going to do a segment.
What's the segment?
I'm going to call it Weird Word Stuff.
It should be weird word. What's another W?
Weird Word Wonders.
Weird word
Wonders of weird words.
Okay.
Anyways, so I found something interesting kind of when getting into what placebo actually means is that this phrase placebo effect that everyone thinks of. So, you know, an internet definition of that might be you give someone a placebo and something happens.
And that's the placebo effect?
Right, yeah.
Okay.
Usually it's beneficial, and there's an opposite called the nocebo, but we won't get into that.
Oh, no. Okay.
So basically, the phrase placebo effect is kind of paradoxical because placebo means something that doesn't cause an effect. That's like the definition of inert, which is the definition of placebo.
But it is causing
an effect. And effect says, oh yeah, it's actually causing an effect. So you're like, well, what the heck does that mean?
The effect of something that doesn't cause an effect.
Right. So that right away makes no sense. So the word placebo actually comes from a Latin verb that means to please. So placebo is like a conjugated verb. It means I shall please. I don't know how you conjugate.
Sugar Pill says I shall please.
Yeah, but that still doesn't make any sense, right? That still doesn't tell us why we call placebo that. So we're not quite there yet. So the next thing that I kind of looked into is, well, why does placebo now mean something that's fake? And that goes all the way back to this mistranslation in the Bible, where this one guy was translating the Bible from...
Just one guy?
Yeah, I think his name was Saint Jerome. So he's translating the Bible from Hebrew to Latin is, I think, what he was doing. And he messed up on a line, like he didn't know his Latin very well.
Shouldn't have been the translator then. Should have got someone else.
Right, so the word placebo in Latin ends up in this line that he's translating. That line, that mistranslated line that he wrote, actually became something that was used by mourners to chant at funerals in the 13th century.
The placebo line.
Yeah, the one that started with placebo. And these mourners, a lot of times you could hire mourners to make yourself seem more popular.
Oh,
and
that's pretty sad.
Yeah, I think that was the idea anyways. And I guess people used to call these hired mourners placebos because their actions were kind of fake. And so that's the segment. That's weird word stuff.
Oh, okay. Who are some of the major researchers in placebo effect right now? Okay,
sure. Yeah, so when you do an internet search, you're not going to get a very good definition, and there's going to be a bunch of stuff missing.
Yeah.
So then the next thing to do is to kind of look into these big researchers and figure out what they're saying about placebo and see if it matches up with what the internet says. So our two big researchers that you really can't get away from when you're looking into stuff about placebo is an Italian man named Fabrizio Benedetti, and he's a researcher at the University of Turin in Italy. And then an American named Ted Kapchuk, who's a researcher at Harvard. So there's a bunch of other researchers looking into placebo, but these two come up just about everywhere. They have they're in all the media, so for some reason all their studies have been chosen by the media to kind of be out there for the public.
Do you mean they've been interviewed a lot, that sort of stuff?
Yeah, they've been interviewed a lot. So if you ever hear about placebo in the media, they're usually interviewing either Benedetti or Kapchuk, it seems like. There are other...
Maybe they're the ones that agree to interviews most.
They're the only ones, yeah, who knows. But you can't really talk about placebo without talking about these guys.
Okay, and so what are they saying?
Okay, so I'll read here what I have for Fabrizio Benedetti on what he might say the placebo effect is.
Okay.
So he kind of starts off with exactly what the internet said the placebo is, and he says, no, it's not that.
He doesn't like that. No, so he doesn't like that it's a fake medicine that does have an effect.
He said, placebos are not inert substances, as thus far believed. They are made of words and rituals, symbols and meanings, and all these elements are active in shaping the patient's brain. So a placebo is the entire ritual of the therapeutic act. And it's part of the response to any active medical treatment. So he's saying there's all these parts of it that we don't understand, and it's definitely not just the pill.
So yeah, it sounds like he's saying that how you get the pill or how the doctor is acting or the nurse is acting or something has an effect as well.
Right. Yeah, that is what he's saying. And as we'll see, that's all that kind of stuff that he just mentioned is really hard to measure.
Yes.
But
because it would have to do with people's perception, maybe. Like maybe the doctor could act in the exact same way, but if one person perceives it differently than another, they might feel a different effect.
Yeah. Oh, there's all sorts of issues.
Yeah.
But what he is saying is that no, the kind of general internet definition doesn't really capture what it actually is. And Benedetti and Kapchuk pretty much agree on a lot of things. They have several publications together.
Oh, they're buddies.
Yeah, so there's a definition from a paper that had Kapchuk and Benedetti and several others, but they said it's the simulated treatment and the clinical context of that treatment. So they said, it's not an actual treatment like you might expect in the conventional form of that word, where like you give a pill that's been specifically designed to do something. But it is still a treatment, and it also has to do with everything involved in the context of that treatment. But they say that the placebo effect is a genuine psychobiological, meaning it affects your biology, like the physiology, your cells, and your psychology, so how you think.
So do you have some examples of how they saw like the ritual you said of getting the medication, or beyond the whole setting, beyond just the medication itself, that like caused more positive effect? Or
what do you mean?
Well, you said like they thought that it's not just the medicine, the sugar pill, whatever, it's the whole environment along with getting that. So what does that mean? Like what aspects of the environment?
Okay, yeah. So there'll be this one study that I think we can kind of use as an example. It was, as far as I can tell, it was kind of Kapchuk's big like breakout study, and it's been cited by a bunch of people now who are continuing to do research.
Is this pretty recent stuff, or is this?
So the one that I think
bit?
it's all recent. It's kind of the placebo. The research is really starting to kind of ramp up now. But has been around since 1950, which was the original kind of study that was published mentioning placebo. So we can get to that too.
Okay.
But okay, to your question. So there's a study that Kapchuk did on irritable bowel syndrome, which I think has this history of being kind of really hard to treat.
Yes.
And everyone kind of reacts to medications differently. So you can see why it was important to do that. Okay, so I think the easy answer to your question from the study is that one of the groups, even though this is kind of silly, because as a healthcare provider, you're going to be like, well, everyone does that. But
okay.
So one of the groups.
Oh, this reminds me of another question, but go ahead.
Okay. So one of the groups, part of their treatment as being part of that group, they received empathy from their healthcare provider that was providing the treatment.
Well, not everyone does that,
right?
But they should.
So this is the exact phrase they said: "I can understand how difficult IBS must be for you." And then it was followed with 20 seconds of thoughtful silence while feeling the pulse or pondering the treatment plan. So this
20 seconds is a long time.
So that was
silence.
Well, I think the patient could respond, but the practitioner then listened after they said that.
And 20 seconds, you're done. Cut it off.
You asked for an example, so I gave you one.
Okay, no, that's good.
So things like providing empathy. They talk a little bit about like the area that they were given the medication. So like, what does the doctor's office look like?
Oh, I thought you meant like in an IV or in a pill, or.
I think they do that too, but I'm not sure if they do that with this one.
Okay.
Anyways, the IBS study looked at acupuncture, and I haven't mentioned it yet, but Ted Kapchuk was originally trained in Chinese medicine and did acupuncture for a long time.
Okay.
Before he stepped into the role that he does now with the placebo research. So a lot of his studies use acupuncture as their kind of placebo treatment.
So does he feel like that's what it is after working as an
He totally
acupuncturist?
does. Oh yeah, he's absolutely. I've heard him say in some videos that he thinks that acupuncture is a placebo or a placebo effect.
Okay.
But there's nuance to that too. Like that doesn't mean that he thinks it's not worth doing. So
well, it does help people. There are lots of studies that show a good effect of
exactly.
acupuncture.
So, but he's trying to change the meaning of placebo in the general public's eyes. So when he says something like that, he's not saying that acupuncture is not worth doing. Mm-hmm. He's saying that the mechanism that is originally thought of what's causing the change in acupuncture is probably not right. It's probably actually a placebo type of mechanism.
So I'm wondering if the part of the placebo effect is the environment of care or treatment.
Yeah, definitely.
What about actual drug studies and that are studying a drug and a control to look for an effect? Mm-hmm. How do they... I guess it would just be a larger effect in a drug that was effective versus a placebo effect. Is that what you would say? Because how could a study differentiate between a doctor that was especially caring when giving this trial medication or versus the placebo effect versus a drug that really worked?
Well, I think the answer is that they wouldn't. When a drug company is doing a randomized controlled trial, a clinical trial to see if a drug works, their definition of placebo is very different than the definition that we've been talking about today.
Okay, like what?
So here's a couple of things that aren't placebo, that aren't the placebo response, but that the drug company would consider placebo response. So regression to the mean is one. That's kind of similar to spontaneous remission, where you start out and maybe your condition is not so good, but then it gets better over time without any treatment, kind of.
Okay, so not an expected outcome.
Right. And that's also similar to natural history of a disease. Mm-hmm. If it's supposed to get worse or supposed to get better.
Like a cold is just going to get better.
Uh-huh.
Right.
And there's also kind of bias both of the patient as well as the care provider, whoever's doing it. So when a drug company is doing research to see if a drug is effective, they're calling all these things placebo effect. They're calling everything that isn't the effect of the drug, basically. And kind of what I found is that that's not really what a true placebo is. Mm-hmm. A true placebo seems to be more of something active happening in the brain after the admission of a placebo, and doesn't have to do with all these other things that a drug company would consider placebo.
Okay.
So that's another thing. Just kind of consider when you're reading a study about a drug and they said, oh, well, the placebo was, the placebo effect was this or was that. That's probably not the true placebo effect. That's probably just what wasn't the effect of the drug. And so that includes other things that you often don't think about.
Mm-hmm. Okay.
Okay, so why should we care about this? Are you convinced we should care yet? Or do I need to convince you?
No, I think we should care about it, but I think maybe you brought up slightly the ethical issues, because it seems like it would be great. Less drugs needed. That seems like that's healthier for people in general, and it saves money. But, you basically have to be faking people out, right?
Yeah. Well,
and how sustainable is that long term anyways?
Probably not.
Yeah.
But I think you bring up the most probably important ethical issue, and that's the deception aspect of it. Mm-hmm. And so we'll get to that. My first thing that I want to say for why we should care about it is that people are definitely overusing and misusing placebo and placebo effect.
Really?
Yeah, it's everywhere.
I thought you were going to say pain medicine, but you said placebo.
Well, that's a whole nother issue.
Okay.
It's actually my next topic
Oh, great. Okay.
that I'm going to talk about. But I think especially in like, newspaper headlines or articles, placebo and the placebo effect have branched on way beyond medicine. They can be used for almost anything.
Mm-hmm.
And if you do a Google search of placebo in the news, like you're going to get 4 articles from today.
Mm-hmm.
So it's all over the place. And all I'm saying is that I think it doesn't often mean exactly what people are thinking that it means.
Okay.
And so you need to realize what they're actually talking about. So the second part, let's get to this ethical issue of like, should a doctor use a placebo? Does it require deception?
I guess what you're saying is should they use it knowingly? Because as you said, when a nurse is giving a pain medicine and saying this is going to work really well for you, that is a placebo too?
Yeah.
Even when they're giving it an actual medicine, it
Right.
still could increase the effect of it.
Yeah.
Yeah.
So
But should they intentionally use placebo?
I think you're right. And this gets back to the Hippocratic Oath of doctors, but also kind of any healthcare provider, is that first, you don't want to do any harm.
Right.
And are you actually doing harm by not giving a drug treatment or a procedure that you know will work when you think placebo might be effective as well? So,
Well, a lot of drugs or procedures have side effects, and placebo doesn't really, I would assume.
well, that's not true either.
No?
I read a study that patients were given a placebo, but they were told it had a certain side effect, and 30% of them got the side effect, even though they had sugar pills.
What was the side effect?
They just said like it would give you headaches or something.
Yeah.
Yeah, so a portion of the participants.
Maybe they were just going to get headaches anyway.
Well, probably. So, but who knows?
Seems like a lot of headaches. It's funny.
So, what would you think about if a doctor prescribed a placebo to you but didn't tell you?
I would be upset.
Yeah. Okay. So, what about this? What if you're going to see a new doctor,
Okay.
and you go in, and part of your initial kind of paperwork that they want you to do, there's a document that says, at some point in the future, if my doctor thinks it's appropriate to prescribe a placebo, by signing this, you say that that's okay.
Ooh.
Does it make it okay?
I think it does make it okay, because if you've signed it, you agree to that.
Mm-hmm.
But and even as someone who's like, yeah, placebo effect works, I mean, I think I wouldn't sign it because I think I want the medicine.
Right. It's still weird.
Yeah.
So I don't know. We're not going to answer the.
But maybe, I'm not answering for everybody. Probably some people would be fine with that.
Yeah.
Would you?
I don't know. I think I probably would.
Yeah.
Yeah, I'd sign it. And maybe you'll understand why after my next point, because I think it's more important.
Okay.
But obviously we're not going to solve all these ethical issues or answer them, but they are out there. Mm-hmm. But the reason they're important is that pretty soon, with the expanding research, it's going to be something that doctors have the option of doing, and so someone's going to need to think about them.
Mm-hmm.
But I also think that these ethical issues are important because pretty much every healthcare provider is using a form of the placebo effect, whether they know it or not.
Right, like I said, the unconscious version, right?
Right. So even though you don't think you're administering a placebo, like as a physical therapist, I'm not even ever going to give a drug.
Right.
But
I hope not.
Right. But I might give a treatment.
Right.
Or a treatment.
I hope you do give treatments.
I'd give a treatment modality, and you need to realize that when you're doing that, you are giving a placebo. Mm-hmm. And I kind of think this is the most important kind of fact that came out of my research, is that the goal of the healthcare provider should always be to help their patients heal the best way they can. And kind of after doing all this, it seems like the best way to do that is to use the gold standard treatment or medication or whatever.
Right.
But that's not all you have to do. It's also about how you give that treatment.
Mm-hmm.
So each time a healthcare provider is providing some type of treatment, they need to be considering the environment, the psychosocial factors, the ritual around the treatment in order to get the best effect.
Mm-hmm.
And it seems like if they're not trying to get the best effect, that is almost also a question of, is that skilled therapy or skilled treatment?
Oh, that's interesting to me. That makes me... What I like about that is I feel like that's something that I always try and do in my treatments, but it can take a lot more time.
Yeah.
And like you said, I mean, we have more time than the doctors probably to spend with patients, but we also have to be efficient to some extent and be productive with our time. And it makes me feel a little bit better in that, I do take that extra time with people. I do think it's beneficial to their treatment, and I think that it is a skilled component that increases the value of the treatment. That if you just rush someone through something and they're scared, they don't really get a lot of benefit out of it. Versus if you take the time with them and really slow down to their pace and explain things at a rate they can, understand or process, they do a lot better, even if you do less, hardcore exercise or movement or whatever.
Yeah.
Yeah.
You can think about all these ethical issues like, can a doctor deceive me or whatever. But the real thing that we need to think about is how healthcare providers can use those gold standard medications and treatments with a placebo effect on top.
Mm-hmm.
Because if they're not doing that, then they're really not getting the full benefit of the treatment. And isn't that being kind of unethical?
Mm-hmm.
In my opinion, it kind of is.
Mm-hmm. So that would be more bedside manner type stuff.
I guess, but it's also kind of like the art of medicine kind of thing. It's like your skill as a healthcare provider in terms of the relationship that you can build with the patient. And there was a study
which is a challenging thing with the very tight
right?
schedules that a lot of doctors keep. And I don't know how much that sort of interpersonal relations and stuff is really focused on in med school. Not having gone to med school,
well, maybe
hard
the
to say.
Yeah, but also maybe the doctor doesn't have to do it. Maybe it can be a provider like me or you that has a lot more time we can spend with the patient. I mean, I don't know so much for you in the hospital, but I have
more time. I do have more time than the doctors do.
Yeah, in an outpatient setting, if you're seeing someone,
a lot of the time,
twice a week for an hour each time, you can develop that relationship and be that kind of, placebo effect that really makes the treatment worth it. So why is there a show called Placebo? Why?
Because, like maybe we've talked about in this episode, hopefully you've got the point, that although placebo effect is something that people talk about quite a lot and think they generally understand, there's actually a lot more to it and a lot kind of hiding behind the surface. And that's what we hope our show is going to be, kind of looking at things that maybe you've heard about, maybe you haven't, and kind of digging down a little bit behind what's obvious.
That's like exactly what I wrote.
Oh, I'm a genius.
Well, we really haven't even begun to scratch the surface, but for now, that's it. Did you like our show?
I did.
You did? Well, if you, the listener, did, then we'd love for you to subscribe wherever you get your podcasts, and next week, a new episode will just show up on your feed.
We hope.
Yeah. Well, what if you didn't like our show?
Thank you for listening all the way to the end of this one.
Yeah, if you didn't like it, I'm not sure how you're still here, but if you didn't, that's okay. We're new at this and we want to get better, so...
We think we will. It will just take a little time.
Yeah, so give us some feedback if you want. Our email is placebopodcast@gmail.com, and you can reach us at any of the social medias, too. We'd love to hear from you.
Please be nice.
Or not.
Or not, then we'll just ignore that.
Yeah, well, the people that don't want to be nice are probably not even here anymore.
That's okay, good.
Okay, bye!
Goodbye.